guys, Caelin from Holistic Foot Clinic here, finishing up on our segment on dermatology, so skin and nail conditions of the feet. And today we're going to be talking about what you can be doing at home to both maintain good health and prevent problems from occurring in the future. This is after you've been into the clinic for your treatment, or you've just resolved your conditions yourself with treatments at home. So when we're talking about the skin, corns, calluses and cracked heels, two main things that come in are moisturizing, so maintaining that moisture, whether that's going to be with a basic or a heel balm. And then two is minimizing pressure on these sore areas of the foot, which will both slow down or hopefully stop that hard skin coming back, and also not aggravate areas where you have a hard corn or a cracked heel. So usually that's going to come down to footwear and the type of shoes people are wearing and keeping that pressure down. When it comes to infections, generally talking about things like tinea and warts, you're really going to want to look at where you got the infection and also where you might have spread it to. So for most people, don't think about the fact that their shower floor and their socks actually become infective surfaces that you need to get rid of, especially once you've fixed or cured your own condition. Otherwise, you're just going to give it back to you and possibly spread it to other people. So that's usually going to involve things like wearing thongs in the shower, cleaning the shower floor regularly and cleaning the thongs regularly, because then they become an infective surface. And once you're looking all good from your warts or your tinea, to actually sometimes just get rid of those old socks, because sometimes no matter how much you wash, they're still going to have a chance of reinfecting you again. When it comes to ulcers, we tend to minimize the amount of intensive care patients do for themselves when it's a genuine, difficult to treat ulcer. Of course, if there's a district nursing service that can help people at home, that's another thing. Looking at nails, it can be difficult for people to self-manage genuine nail problems at home. Obviously, if you had nails that were easy enough to treat yourself, you would just do that yourself. But of course, when it comes to things like ingrown toenails, we don't want people playing around with them too much at home, because that's often how these things occur in the first place. Of course, when you're dealing with an infection, whether it's fungal or another type of condition, yes, there are definitely treatments you need to keep on at home, and especially with things like fungal treatments, that can take up to a year sometimes, in which case the power is definitely in the patient's hand to keep on at home. When dealing with any other conditions, of course, medications or treatments that you might have to do, whether from us or your doctor, are going to be very important as well. In terms of looking at some interesting cases that have come up sometimes, we do have a few that tend to create some interesting little nitpicks. We'll have a look down at those below. Take care.